So you are looking to get a therapist. How do you find a really good therapist? It's hard because you don't really know what someone is like in a therapeutic setting. Well, the first question you need to ask yourself is, what do you actually want out of therapy? What are you hoping to get out of it? Because once you know what you want for the end result, then we can work backwards and be able to figure out what would be the best match and how are you going to get there. The next piece is to find out the therapeutic approach that you think will match you best. Now, there's many different approaches, but are you more of the person that wants to do actual homework? Or do you want just to be able to share and vent your feelings? Are you hoping to do different exercises or certain techniques to be able to get to the place where you want to go? So there's cognitive behavioral therapy. That is dealing with your thoughts and behaviors, and it's really kind of hands-on and direct and straightforward. There's psychodynamic work, and that's when you're dealing with past and inner child work and trying to figure out how that works to where you are today. There's EMDR, art therapy, drama therapy, different types of cognitive techniques, neurotherapy. There's so many different therapeutic approaches there, and they're all wonderful, but the next piece is even more important than the therapeutic technique that your therapist is going to use, and that is forming an alliance. The personality type of the therapist is really important. If you don't like the person that you're doing therapy with, it won't matter if their techniques are exceptionally efficient, because you might not share, you might hold things back, you're not going to feel comfortable. You might be in your head, you know what, this is just a load of crud. I don't buy it, or I don't even like them. And some people you might feel uncomfortable or feel like you're being judged, and so you're not going to choose to share in the first place. Now, that might not happen after the first session. You're first just getting to know each other, but it's really important that you feel comfortable with the person that you're doing therapy with. And if you don't, after a session or two, it's okay to find a new therapist. You don't have to worry, we're not going to have our feelings hurt. It is just that no matter what, not everyone is each other's cup of tea. Is the therapist opaque or transparent? That means, do you want someone that's kind of that blank slate, that old Jungian Freudian kind of, I'm not going to give you a lot of information back, not going to show a lot of empathy, so you can impart whatever feelings and thoughts you want onto the therapist? Or someone that's very transparent, really emotional, shows empathy, will perhaps discuss things back. That's a very different realm, and different therapeutic approaches will lean more towards one transparent or one opaque. I'm really emotional and I'm going to share that. I feel more comfortable being that, and that's the kind of therapist that I would want, but that doesn't mean that that's the therapist that you might want. Do you want someone that's very clinical, that's going to be going through different therapeutic approaches and the science and the biology that's behind it? Or would you want someone that kind of is taking you on a journey, that's going to be able to kind of go there and is dealing with more of the emotions and how you feel about that? Talkative or quiet? It's very interesting because people have very different feelings about this. I am more chatty by nature, but I try to hold myself back when it's your turn to talk. Other therapists are going to give you a lot of space, allow you to be able to share with them the things that you want to share and the things that you don't. This is something that can make people feel really uncomfortable, really not, if you're not used to it beforehand. If someone is too warm and friendly, you might be like, you know what? I want someone that's a little bit more clinical, a little bit more hands-off. That way that I can be able to trust that they know what they're doing. And other people might be like, you know what? When someone is too clinical, I might feel like I'm being judged or what are they thinking? And I'm too busy in my head to be able to really let down my guard and share. Directive versus non-directive therapy. So for some therapists, they are going to give you direct homework, going to be able to tell you how they feel and what they see in that. You're coming to me as a specialist, and because of that, I want to share my knowledge and what I think about a situation, but we're going to work kind of together to be able to figure out how we have to get to that path. Other therapists are going to want to give you the clues, but want you to find your path on your own. And so it might be a little bit more work at the beginning feeling, and it might take a little bit more time to be able to get there, but when you get there, it's because you got there. How would you know that it might be time to see a therapist? My first thing is that it's when, one, you might want more from life than what you are getting. Two, you might be repeating similar patterns and they're not ending up with the results that you hope for. And then the third is life distress. You're not feeling good. You're not feeling happy. If that is happening for a prolonged period, therapy might be the answer for you. Again, I don't think that it's the answer for everyone. For some people, sharing is really, really hard and it can be painful. Though I really do think if you find the right person, it can be wonderful and actually a very safe and comfortable experience. I think that people often think that therapists are really judgmental. We're probably the least judgmental people out there. We've heard and seen some of the most extreme stories. You're probably not going to shock a therapist. I'd be impressed if it did. And so because of that, we really do understand that we're all just human and doing the best that we can. When would be a time for you to leave a therapist? Well, if one, you don't feel a connection, two, you feel like you're not getting better, and three, if you find that you feel worse after therapy, which sometimes can happen. Let's be honest, good therapy is not happy and positive all the time, and it's not I'm feeling in distress all the time, but you want to be in that stretch zone where you're a little bit uncomfortable sometimes, you're trying things a little bit new, you're growing. It's just like working out. You want to be able to work that muscle a little bit so you feel sore the next day, but not so that you've torn something. If something isn't working, there's nothing wrong with you saying, you know what, I didn't like this and this, or you know what, this is what I want to do today. You're there as a teammate. Therapists are really good about reading people, but we're not psychic. And sometimes we may say or do the wrong thing. And sometimes therapists also, we just have an off day when we're not able to really read the cues that we should be reading. And so I think that it's a wonderful thing to be able to share with your therapist if you feel frustrated or upset, or they said something that made you feel hurt. If you don't feel comfortable enough to be able to share it with them, you can write it down, or you can let them know that I want to share something, but it's going to be a little bit uncomfortable for me. And your therapist will probably do a good job with trying to make you feel comfortable and be able to hear it. When do you stop therapy? Well, you stop therapy when you want to stop therapy, when you've gotten what you think you feel like you should have from therapy, or you feel like there's a time that you need a little bit of a break to be able to work on things. You can always go back to your therapist after, so you don't have to feel bad. Also, you may want to try out different types of therapy in between. I don't mind that at all. I like working as a team, and I think that there's many paths to Rome. So say that you want to do yoga because you feel that that's something that you need, and because of that, you're going to be taking a break from therapy. That's wonderful. This is your path, and you don't have to feel bad or worried that you're going to be making your therapist feel bad. It's our job to be able to help you. How long do you do therapy for? Well, there's different things that take different amounts of time. Say that you're dealing with a basic, straightforward phobia. Well, maybe if it's the dark, it's going to be about 4 to 6 sessions. If you're dealing with elevators, it's probably 8 to 12. If you're dealing with a driving phobia, it's multi-layered, so it's probably a little bit longer than that. There's basic levels for most treatment approaches, but you never know. Sometimes life happens or different pieces come up. You stop therapy when you want to stop therapy, and you can go back to it if ever you see the need. The wonderful thing about therapy is that when it really works, it can be completely magical. It really is about you learning about who you are, and you're figuring out what are the triggers, the wounds, the things that are holding you back from living the life that you should be living. And it's interesting because we spend all this time at school learning about geography and math and science, and they're all really important, but we don't spend any time about learning about who we are as a person. Why do people get anxiety? How do we deal with conflict management? Well, how do I build up my self-esteem? These are questions that are at the core of our own growth, that will be directly related to our own resilience and our ability to be successful in life. I, again, take it with a grain of salt because I'm a therapist, but I think that out of all of the things that are worthwhile to spend your time in, isn't learning about who you are as a person really important? You're building yourself up. It's like training yourself to be better at life, to be able to figure out what are the pitfalls that you will fall into or that you've been falling into. What are your attachment types and who are the people that are good for you and who are the people that are not? To be able to face your fears and deal with things in a more concrete manner. These are wonderful things that you can learn, and it may not be therapy. It might be doing your own workbook, or it might be doing your own self-growth or meditation or yoga or art. It might not be therapy, but I really do believe that we should be taught this in school. This is something that we should all, from a very young age, learn about because it's so hard. We kind of go through the world, all of us blind, just trying to be loved and respected and cared about. And we're doing the best we can with the tools that we have. But if we've been really hurt or we weren't taught these tools or we don't know about ourselves, we can often fall into these pitfalls and feel really lost and alone. That's what really great therapy is about. It's about you discovering yourself and learning better tools so that you can truly live better. And if you like psychological videos, I have videos on negative self-talk and Are You a Sociopath and how to deal with anxiety, all ad-free, sponsor-free on Nebula. And you can also take a look at Apple Talk, where we have extra segments only on Nebula, where we deal with eating hot chili peppers or hot wings. And it's not just my videos, but Nando V Movies, Midlife Crisis, Renee Ritchie, MKBHD, Cinema Wins, and so many more. All ad-free, sponsor-free on Nebula. Bundled in for free when you sign up at today's sponsor, curiositystream.com/Georgia Dow, or click on the link below. Here, and that includes thousands of amazing documentaries and series, like Nature's Weirdest, where you get to decide, what is nature's weirdest animal? Is it the sloth? Is it the rockfish? You get to pick. Just click on the link below, curiositystream.com/Georgia Dow. And by clicking on the link below, you really do a lot to help support this channel. So I hope that you enjoyed this video. If you did, please hit subscribe. And if you want, you can share your own thoughts and ideas in the comments below.